This skill is perineal care. Wash hands, knock knock. Good morning, my name is Xavier. I'll be your senior for today. Is it okay if I check your name band? Mary Smith, nice to meet you. How would you like to be addressed? Mrs. Smith? So Mrs. Smith, I'm gonna help you with private care today, is that okay? All right, so I'll be back with the supplies. So I'm gonna wash my hands, I'm gonna grab my supplies, and then I'm gonna wash my hands again. I'm gonna close the curtains, and I'll adjust the bed to a comfortable position. I'll lower the side rail, and I'll put on my first set of gloves. So Mrs. Smith, I'm going to ask you if you can cross your arms and cross your right leg over left leg. I'm just going to put a Chux underneath you. So on the count of 3, we're going to turn. 1, 2, 3. So they turn to the side, and let's place a Chux alongside their back. Okay, on the count of 3, you can lay back down. 1, 2, 3. And then the next thing we're going to do is make a diamond out of the bath blanket. So what you need to do is you take the corners of the bath blanket and move it towards the middle. Make sure the patient is not exposed. Once you have the diamond, you're going to turn it so that it's a square. I'll take this top flap and I'm going to cover the patient. I'll also place a towel over their chest. And then I'm going to have the patient bend their legs. So there are 2 side flaps. You need to wrap them around the feet. So we'll take this side and then we're just going to wrap it. Make sure they're covered. And then the other side flap, we're going to wrap this alongside the feet as well. So the last towel, we're going to place this over the legs to keep them covered. And then we have the bottom flap, which we pull over so that way we can expose the perineal area. I have my water, it's 105. I test it. I'll have the patient test it. They say it's fine. Check the perineal area for any redness, any skin abnormalities. I'm going to get water, soap. You're going to open the labia with your other hand, and then you start cleaning from the furthest side from you. So 1, 2, 3, and then rinse. 1, 2, 3. So 1, 2, 3, rinse. 1, 2, 3. Always going downwards. So this will go into the hamper. I'm going to pat dry, and then I will make sure to change my water and change my gloves. So I have a new set of gloves. Loosen the bath blanket. I'm going to reuse this one for the back side. So we can kind of straighten this out. Mrs. Smith, if you can please cross your arms and cross your right leg over left leg. On the count of 3, I'm going to ask you to turn. 1, 2, 3. So they turn to the side. And we're going to clean the back side. So the towel that was on the chest, I'm going to put it on their back side. I have a new washcloth, new gloves, and new water. I have them test it. Water, soap. We're going to clean upwards, so 1, 2, rinse, 1, 2. Use a clean corner, index, pinky, going upwards. This can go into the hamper. I'll pat dry with the towel. The Chux I'll put into a garbage. I'll wash hands. All right, Mrs. Smith, we're going to lay back down on the count of 3. 1, 2, 3. I'll lower the bed to the lowest position, check for body alignment, and make sure that the bed is locked. My last set of gloves will be to clean up. I'll dump, rinse, and dry this basin. I'll put this in their personal belongings, and this will go in the trash. I'll wash my hands. Mrs. Smith, here's your call light, your phone, tissue, water, magazines. If there's anything else you need, just let me know and I'll be right back. I'll open the curtains, I'll wash my hands, step outside, record, and report.